I am Dr. Abha Majumdar and I have been working with the IVF department of Sir Ganga Ram Hospital since its inception in 1990. I have been the director of the same department since 2009. Fibroids are benign tumors which may be very small and absolutely inconsequential, or they could be large, even mammoth size fibroids. So everything depends on where they are placed, how many are they, and how big are they. Generally, they don't affect conception or pregnancy, but if they are big in size, they affect pregnancy, the outcome of a pregnancy also. And if they are situated in places where they compress the tube and hence the tube is blocked, or they are on the surface of the lining of the uterus where the baby has to come and implant, then they may inhibit implantation. So what I really suggest is that a good gynecologist should be able to assess that this fibroid need not be touched, because removing a fibroid renders the uterus with a scar, and this scar may make the uterus weak for subsequent pregnancy distension, and the uterus might rupture also. So it is very important to know where the fibroid is, which one needs to be touched and removed, and which one can just be left alone. Well, these are the controversies which I told you, that leave alone the subserous fibroids, intramural ones, if they are smaller than 3 centimeters, leave them alone. But if they are submucous in situation, then they 100% need to be removed, because they would lead to infertility more often. Okay. Endometriosis is a condition where endometrial tissue grows out of the uterus. It is not where it was supposed to be. So this happens with possibly menstrual blood also flowing retrograde into the peritoneal cavity, with some type of genetic predisposition where these cells of the endometrium just implant on the surface of the peritoneum, and then they start growing there. They may make cysts, or they may sort of form adhesions between the tube, ovary, uterus, peritoneum, everywhere. And it has 4 grades: the mild and minimal, and then comes the moderate and severe. Moderate and severe is bad because by virtue of its extensive nature, it is a lot of endometriosis in the ovary. It sticks to the uterus, to the peritoneal lining, and makes the tubes almost immotile or immobile, and hence these tubes lose their function despite being opened. Minimal and mild endometriosis generally affects pregnancy in a negative way by immunological effects. It leads to a lot of immune bodies collecting in the peritoneal cavity, and hence the tubal pickup, the egg quality, and the implantation of the embryo goes for a toss. When you talk about management of endometriosis, well, endometriosis could present as simple pain, and we can give medical management for that. But if it presents with infertility, then surgically diagnosis and clearance of endometriosis is the best mode of treatment for a woman who wants to conceive.